Good morning, doctor. Can you please introduce yourself?
My name is Martina Messing-Jünger and I am working as a pediatric neurosurgeon in Germany, in the city of St. Augustin, where we have a children's hospital.
How long have you been using PIEZOSURGERY for?
Actually, I do not really know. I think it must be more or less 4 years. I think so.
What made you change from traditional rotating and oscillating tools to PIEZOSURGERY?
So, pediatric neurosurgery is dealing sometimes with very delicate bone and delicate bone cutting, for example in cranial deformities, but also in spinal surgery. And we were looking for instruments that were very well steerable and had probably also very thin bone cuts.
Which procedures are you using it for?
So, actually we have experience in using it with craniofacial deformities, and we are also using it when we are trying to harvest split bone grafts in the calvaria, and we more or less regularly use it for performing laminotomies in spinal surgery.
After the adoption of PIEZOSURGERY, have you changed the way you do some surgical procedures?
So in craniosynostosis we are varying. We always have all facilities at the table, and depending on the bone situation, also sometimes on the age of the patient, we are switching between traditional bone cutting instruments and also PIEZOSURGERY instruments. And as I said before, in laminotomies, where we cut the laminar structures of the spinal bone, it is becoming a routine in our department. And when we need to do cranioplasty by using split graft, we also use it routinely.
Are there today surgeries you would not do without PIEZOSURGERY?
So actually it is not an instrument you could not live with, but it is of course very advantages in certain situations. So actually if the machine would be broken, we would not cancel the surgery, but hopefully it is not happening.
Thinking about your patients, which are the main intraoperative and postoperative advantages you have observed?
So you are having a very nice control over your bone cutting and bone modeling, and this is first for the quality of your bone cutting an advantage, and also I think in certain aspects it is an advantage in respects of safety, especially when you are thinking of cutting the dura, which you would like to avoid in, of course, most of the surgeries.
In your opinion, is there any disadvantage in using PIEZOSURGERY?
So, for those guys who want to run fast, PIEZOSURGERY sometimes needs more time. Not significantly more time, but it takes a longer time in some bone cutting compared to some other modalities like high speed or whatever.
How long did you take to master the technology and fully understand how to use PIEZOSURGERY devices?
So, since we started to use it pretty early, and we were using the first generation tools that were probably not originally designed for neurosurgical use, then it took some time to find the right way to use it. But then we were talking with the people of mectron and making suggestions like other colleagues as well. And now the second generation of tools is very easy to handle, and I think there is not a large learning curve you have to go through.
Is there anything else you would like to add?
Actually, with the new tools, I think for the moment I'm not having an idea how to improve them.
Thank you, Doctor, for your time.
You're welcome.